rods, and you may think, all right, you know, I've gotten to a place with whitening and I'd like to see a little bit more in my results. Or maybe you're just getting started with whitening and you're thinking, you know what, I really want to jumpstart my whitening program. This is a great way to do it with these rods. All right, so they come individually packaged like this. So how are we using this rod and who is it right for?
Right, so I want Jamie to show us how to use this, and I'll talk about this while Jamie shows us how to use this. These activating rods, so we have a protocol called 6 minutes to a Supersmile, and this is the first, this is if you really want to jumpstart your whitening, you know, at any point during the month. And what we have here is these are peroxide and sodium bicarbonate filled, it's a filled tube, and what you'll see is we put a little bit of a cotton swab. It breaks off, the little top breaks off as I think we saw before, and you're just gonna stick the cotton swab into the tube very slowly. You'll see Jamie's slowly turning it, eventually until you'll see, it's probably tough, a little bit tough to see on here, but the top of the cotton swab will eventually get moist. And once it gets moist, you're going to rub this over the surfaces of your teeth for just 1 minute. There you go.
Okay, so this is something that we're doing to jumpstart.
Jumpstart, right. So I recommend doing this at the beginning of the month and at the end, beginning of the month and the middle of the month.
Could we also do it if, like, okay, for example, in the summer season, I'm just gonna be real, I love blueberries. I love them so much. I can actually see a difference in my teeth from blueberries or any kind of berry. Sure. Would this be a time when I could say, you know what, I think I need a little extra whitening? I would use an activation rod?
Absolutely. You know, we talk about doing this at the beginning of the month, at the middle of the month, but there are people out there, and I've been known to do this multiple times a week. People use our activating rods, love our activating rods. And as I said before, we have a protocol called 6 minutes to a Supersmile. And the 6 minutes, the first minute is comprised of using the activating rods.
Okay.
And you go straight from the activating rods into brushing your teeth for 2 minutes.
Okay.
Then you're gonna use our rinse for 30 seconds. You're gonna brush your teeth again for 2 minutes, and then rinse out again with our pre-rinse again for 30 seconds. All that comprises 6 minutes. But the thing that starts it to really clean the teeth and really kind of jumpstart that whitening is our activating rod. So I can't speak of those highly enough.
So, okay, if I am new to whitening, let's say I've never done this before, and I'm about to put an activating rod on my teeth, am I going to experience sensitivity?
No, no aspect, you know, we can't say, you know, look, certain people, they'll have sensitivity for one reason or other to any ingredient. I can't say, you know, 100% no one will have sensitivity to a particular ingredient, but basically, Dr. Smigel developed this system with the premise that we're not using any ingredients that are meant to cause sensitivity. We're not using that silica. We're not using any abrasive ingredients to scrape stains off teeth. Everything here is done chemically, not abrasively. And our activating rods are a testament to that as well. So I think you just showed everyone, right? Just to snap the cap off of the activating rod.
Yeah.
You're gonna put the cotton swab in that peroxide and sodium bicarbonate fill tube until the cotton swab head gets a little bit moist with liquid, and you're just going to brush it over the surface of your teeth. And I think Jamie and I were talking about this earlier. It tastes good, right? It tastes sweet.
Oh, it is sweet.
Yeah.
You know what? It kind of reminds me of the pre-rinse taste a little bit.
Yeah.
Now this is great too because you can get very specific, which I like. So if you have a trouble area, can you like let's say I have a trouble area right there, I could like really get in to that one spot.
And you can put it in your, if you're a guy, you can put it in your jacket pocket. If you're a woman, you can put it in your pocket, your purse. When you're going out, if you're going out to dinner and after dinner you have, you've had a red wine at dinner, or you've had, a dessert with blueberries, as you said. Take this in the bathroom, rub it over the surfaces of your teeth. It's really great for getting rid of stains.
Okay, if I picked up the pre-rinse today, and let's say I'm gonna do a system at home, am I using the activating rod before the pre-rinse or the pre-rinse before the rod?
I say to use the activating rods twice a month. If you're gonna implement it into your daily regimen, I would use the activating rod and then go straight into the brushing. I would not go from the activating rod to the rinse.
To the rinse, because
not that it would be any harmful, but the most optimal way to whiten your teeth is to go from the activating rods, go straight into brushing, and then after brushing, you can use the pre-rinse. I know it's a little counterintuitive. You hear the word pre-rinse, you should probably use it pre-brushing, but I use the pre-rinse and the toothpaste and the accelerator rather interchangeably.
Okay. Tanya in our Facebook chat says, do the activating rods help with plaque and tartar removal as well?
Right, yes, and absolutely. It's cleaning the surfaces of the teeth. So within minutes after brushing, there is a protein film that forms over the surfaces of the teeth. And this film acts as I like to say, like a dartboard for stains, for tea, for coffee, for red wine, for nicotine. You know, they say anything that stains your shirt will, anything that stains, a white shirt will stain your teeth.
Sure.
And this is meant to remove that protein film from the teeth and clean the surface of the teeth. And then after you do that, really hit it again with the toothpaste and the accelerator, the pre-rinse. One of the things that's great about this system versus a conventional whitening toothpaste, which simply work by whitening, quote whitening, as we talked about, by scraping stains off of the teeth. What I love about the Supersmile system is we're hitting it from so many different angles, right? We're hitting it with the pre-rinse. We're hitting it with the activating rods.
Okay.
We're hitting it with the toothpaste,
And the
toothpaste here that
Yep.
gets rid of the surface stains. We're hitting it with the accelerator that gets rid of the deep stains. So we're hitting it from so many different angles.
It doesn't stand a chance.
It doesn't stand a chance, and we're doing it in a way that's not really changing your routine, other than the activating rods, which probably
but
most people aren't used to.
2 times a month, I mean,
Yeah.
whatever, you know,
Yeah.
it just
And
takes
for a minute.
30 seconds. Right, okay, a minute, there you go. All right, so let's look at some results. This is kind of, Supersmile overall results. This is after just 1 day.
Yeah.
Incredible.
After 1 day, and I think I've said this before when I've been on with you, patients that come into my office when they talk about whitening, I always hear the same 3 things. I hear the words money,
Yep.
effort, and time,
Yep.
right? How much is it gonna cost me? How much effort is it to get my teeth whiter, and how much time is it gonna take? Well, you can see here, this is after 1 day. So time, in this case, not an issue, and it's only gonna get better. After 1 week, the teeth get whiter. After 1 month, you'll see, this is Robin, how much whiter her teeth, not just her upper teeth, her lower teeth, which are always the most
Right.
stubborn teeth. Money, we're talking, I don't work at the money here, but I can tell you it's pennies a day. I spend 10 times as much on coffee, which stains my teeth, versus toothpaste, which whitens my teeth.
Exactly. Well, here's the thing. I also don't think you can put a price on your smile, right? But at the same time, I mean, let's be reasonable. I think your time alone going into the dentist, I had a professional whitening done years ago at the dentist's office, and A, yes, it was expensive. It was an investment. B, I got major sensitivity, and C, it was not pleasant.
Yeah. And I'm a dentist.
Sorry, Dr. Rashbaum. But now that you bring us products like this that we can get just as white as going into your office, I would much rather do this at home. You're getting 12 of the activating rods here. I just wanted to show you one more time how you're going to do this when you get it home. They're individually packaged, so you'll open it up and take out the 2 pieces that are in it. You'll see that one's a cotton swab, and you'll see this blue tip here. You're gonna just snap this off from the top. So that snaps, all right? And you're gonna take the cotton swab and slowly push it in. There is, what is this right here? This is the activating fluid.
That's activating fluid.
All right.
It's got,
So there you
sodium bicarbonate, freshens breath, hydrogen peroxide.
So what it's doing is it's pressing it up into the cotton swab here.
Yep. There you go.
There you go. So you'll want to do that slowly, okay?
You can even turn it, as Jamie was doing before, you can even turn it as you're putting it in.
Oh, okay.
Yeah.
Well, okay, so this is crazy, I know, but every time we've done this on air, Dr. Rashbaum, which I think is only maybe 1 or 2 other times, but it was just reminded of it when I looked in the mirror here. I always feel like my teeth look whiter right away. Is that possible?
I remember you said that.
Yeah, because I just felt the same way. I was like, whoa.
You know what's funny? You were saying earlier how having your teeth professionally whitened, right? It was really, really painful.
It was.
As a dentist, okay, I can tell you as a dentist, even just as a regular person, having my teeth professionally whitened in a dental office, sitting under a blue light, I kid you not, was one of the 2 most painful experiences of my life. I won't tell you what the second one was, but the first one, one of the 2 was having my teeth professionally whitened. It was so uncomfortable. My teeth were sensitive
Do you get
for 24
zingers?
hours.
I got zingers.
Yeah, I had zingers for 24 hours. And you might say to yourself, well, he's saying that, but as a dentist, I know he does that in-office bleaching in his office. I can tell you right now, I do my very, very best to talk patients out of in-office bleaching. We have a whitening room in my office that I can tell you I use only a handful of times per year because I have mostly sworn my patients off of it. I hand them the Supersmile. Occasionally you get the stubborn patient, oh, I want that 1-day whitening. But 1-day whitening, what 1-day whitening does, when you sit in a dental office and have that blue light over your and the gel over your teeth, it's really dehydrating the teeth, right? It's pulling all the moisture from the teeth. So what happens? After your whitening, immediately your teeth look dehydrated, they look white, they look chalky. Everybody always likes it, right? They look great, right? But nobody really likes to talk about the 24 hours after when your teeth are sensitive and they're causing you a tremendous amount of discomfort. Afterwards, within 24 hours, when the water starts to rehydrate back in the teeth don't look as chalky and they don't quite look as good. We always get that comment after patients come into our office after spending hundreds and hundreds of dollars on in-office whitening, which like I said, I do very, very rarely. You know, doc, my teeth don't quite look as good the following day as they did yesterday. And I said, well, this is the reason why. Slowly but surely is the way you want to approach whitening.
They don't get yellow overnight, right? We whiten them overnight, you know?
Develop a routine. And if you can develop a routine to whiten your teeth that solely involves brushing your teeth, why wouldn't you want to do that?
Right. All right. So we have one more piece to our puzzle here, and this is the powdered mouth rinse. And the reason it's powdered is because it's in these single uses. All right. So you're getting, I believe it's 60 of them. Is it 24? Wow. Sorry. I don't know where I was. I guess you just picked up a couple of these. Okay, so $29 gets this one home, but there's 24 and it comes individually packaged. So now there's no excuse, right, when you're traveling that you can't continue with your mouth rinse. All right, so why do we need this mouth rinse?
So Jamie's going to show us how to use this.
Okay.
And this mouth rinse fits right into our system of whitening, of freshening breath, and doing this non-abrasively. This powdered mouth rinse does have Calprox in it.
Okay.
As we talked about, our ingredient that will pull surface stains from the teeth. This is a great rinse to travel with, right? You can take this on a plane, and all you're gonna do is you're gonna pour water into the packet, and then cheers. Cheers, and just rinse for 30 seconds, just as you would anytime you rinse your mouth, and this will freshen the breath. This will whiten the teeth. This is antibacterial, so it will help get rid of the plaque, the bacteria that's in the crevices underneath the gums you were talking about earlier. Crooked teeth, really getting in those nooks and crannies, and that's what you're doing. So you're going to rinse for 30 seconds, and she's doing a great job with this.
So 30 seconds, I mean, is that a normal time to rinse, or is that, okay. So here's the thing, when we're using this now, so let's just